Hi, I'm Laurel. I'm a licensed therapist, and I wanted to do a short video blog for you today because I've been thinking about trauma therapy, which is one of my specialties, and how it's a little bit different than other kinds of therapy, and I wanted to talk about why and what it looks like. So, trauma therapy needs to be different because trauma is stored differently in our brain than it is than typical memories are stored. I have here a very rough picture of not at all an anatomically correct brain, but more an abstract around memory and how things are stored. So as you can see, all these little stars here, those would be memories, scents, ideas, thoughts, and people, resources, anything you've experienced. Now you can see this little guy here is all alone, kind of in a little box. And that little box is your brain's way of protecting you, right? It's saying, ooh, this is a bad memory. We don't want to think about this. Let's close it off and hopefully it'll never get opened and we don't have to think about that terrible thing that happened or that scary person or that feeling or whatever it may be. And, your brain's protecting you. It's doing its job. The problem is that we do find ourselves in this box sometimes. Somehow there's a certain smell or a phrase, or we see someone, or just something clicks, and suddenly we find ourselves remembering this thing again. And it's really scary because it's like it's happening all over again. It feels very real, and we feel like we're stuck and we can't get back to the rest of our brain. As you see, all of these things have connections to other areas of the brain and other thoughts and memories. This trauma memory, it doesn't. So that's why trauma therapy has to be different, because we're literally looking at your brain functioning differently when reminders of the trauma come up. So what do we do to build these connections to other parts of your brain? Well, there's a lot of things we can do. One thing that's really important, any trauma therapist, it's 101, is looking at resources. Now, resources are anything that connects you to a sense of who you are, a sense of joy, a sense of safety, and contentment. So it can be making art, it can be dancing, it can be cooking, it can be a certain person or a certain place or a smell or a song or something. All of these things are resources. Now, ideally, you have plenty of people in your life and activities where you feel safe, but if you don't, that's okay. You can work with a therapist to come up with a list of internal and external resources to really give yourself a sense of calm and safety and contentment. You have to have that. And then you can actually look into, okay, what is this actual trauma? What is it? How are we going to create those connections? How are we going to link these positive things or these neutral things in your brain to this negative, scary thing? And that looks different for everyone, so I can't tell you how that happens. But a good trauma therapist can help you do that, to make those connections so that if you suddenly find yourself on Trauma Island here, there's a bridge to get off and you're just like, I'm here again. Time to go back to somewhere else, right? Or you can hang out there and be like, this used to really upset me, but now I kind of don't feel anything when I think of it, which that's the goal, right? To have the trauma memory be processed like a normal memory. So you can think about the scary thing that happened without getting your body all worked up over it. So when I work with trauma in my practice, I use a combination of three things. I use EMDR, which is a really well-researched modality that I can offer online. And I use, depending on what the trauma is, I might use a little bit of exposure, which means let's say someone got bit by a dog, and maybe we're going to look at pictures of dogs. Maybe we're going to find a way for you to safely be near some dogs and gradually work up. This works especially well with phobias and other things that totally make sense after a trauma, right? And then, of course, good old-fashioned talk therapy. There's really no substitute for a person-to-person relationship, someone you trust that you can help, that person will help guide you through and resolve that trauma with you. So if that sounds good to you, if what I'm saying makes sense and you're ready to dig in and gently start processing some stuff that's happened to you, give me a call.